My name is Julia Sadusky, and I'm a licensed clinical psychologist in Colorado. I'm the owner of Lux Counseling and Consulting, which is a therapy practice where I offer individual and family therapy for people who have a range of concerns. My specialty is in the area of sexuality and gender, and I often work with people of faith who are trying to figure out the intersection of these different aspects of identity. In addition to the work that I do at Lux, I also offer institutional consultations and workshops for faith-based institutions, including churches and schools, where people are trying to better accompany sexual and gender minorities in their midst. One of the biggest challenges that many of my clients face, in a particular way those who are asking questions around sexual identity or gender identity, is the way in which they carry a lot of hurt and pain within their faith communities. Many of them have felt like they have to pick between their experience of sexuality or their faith, and that they're not allowed to really talk about those things in their churches. Or if they are going to talk about it, they have to talk about it in a certain way. And so for many of them, they carry great hurt, not just about their relationships with people in churches and people in their faith communities and even people in their families, but also concerns and challenges in their relationship with God. And so for them, they come to see me and they feel like having these experiences, whether it's being gay or having gender dysphoria, will preclude them from a relationship with Christ. And that can be enormously painful for them, especially if their faith is really important to them. Another one of the challenges that they face is I think they often become a caricature where people don't respond to them in particular, but they may respond to larger movements in our culture or outside of our faith communities. And people can be very reactive to young people who are asking questions about sexuality or gender. And then those young people feel like they have to kind of have all the answers right on day one. They have to know the right things to say to have a place at the table, even if, when they're being honest, they're not really sure how this all works together and if it all works together. When it comes to accompanying a loved one who's trying to explore sexual identity, the best approach is to really offer your presence, a listening ear, and being committed to taking a long-term view with them in their life. I think of this as reflecting the presence of Christ with somebody and really committing to stick it out with them, no matter where their life leads. So being sure to communicate your presence, your care for them, and most importantly, attuning to the actual questions that they have about what it looks like to integrate faith and sexuality over time. That means listening a lot, asking good questions. What was this like for you when you first became aware of your attractions? How did you make sense of that at that time? Where do you see yourself in 10 years? What things do you have figured out about that? What things are you not yet sure about? And being patient with them in this process, encouraging their relationship with God, and reflecting the relationship that they can have with Him even when they don't have a relationship with God. In the work that I'm doing, I really hope to make space in therapy for people to come and figure out the important questions, to ask those questions without fear and without shame, and to sit with points of tension that they don't have answers for yet. My hope is that my clients know how valuable they are, how much they deserve a life that's full of joy and peace, and where they can actually see their challenges as an asset for them, a way that they can transform suffering into meaning moving forward. I also hope to make a space in our faith communities where people of faith can be well equipped to respond to the needs, questions, hopes, and dreams of sexual and gender minorities, and to better respond than we have in the past.